I was in medical school when the FDA started to require women be a part of clinical trials. What does that mean? That means that any medication that is out there that's being used prior to 1992 or 1993 wasn't required to be tested on women. We're over half the population. We have lots of evidence to support that women's health is not considered important. We're not the norm.
So what can women do? What can patients, doctors, what collectively can be done?
We need to talk about and name what is actually going on. So this whole narrative over the last couple months around the shortage being blamed on women, you're asking for too much, you're too much. We have to point out that that is not accurate. We are not too much. We are just trying to exist and live. So we have to first understand, we have to educate. And that's why I've been so out front about this as a physician, because I understand the system better than a lot of the patients do. Communication is number two. Alliances. The alliances that will change the way healthcare is delivered and paid for are going to be between patients, practitioners, and policymakers. And so we're starting to see that happen, which actually is very positive. If you look specifically at menopause was something we weren't even talking about a couple of years ago. It's all over the place. It's all over social media because the population, the women, the practitioners want and need this information. It represents 20 to 30 to 40% of a woman's life, and it is an important time for us to be aware of our health span, our needs, our longevity, our productivity, our joy, our peace. We are here to help and be a part of the community, and so we deserve more. When we understand that and we partner together, we can get loud and we can make noise. So I'm weirdly hopeful, but I do think that the corporatization of healthcare has been probably the worst thing to happen to our health and to women's health, and we have to continue to call that out and name it.